Hello and welcome to another episode in our series of Naked Truths. This is our third series of Naked Truths. I don't know how it's got there. We do have our little dog here, the centre dog, my little Fusa. She's a rescue from the dog meat trade, aren't you, darling? Yes, I've had Fusa about 8 years. You can hardly see her. She was sitting up nicely going to be part of the video. Now she's decided to get a fuss with Vicky instead. So I am here with Dr. Vicky Simon, who is our holistic vet at the Naked Dog Nutrition Centre. And we're going to talk about digestion and vomiting, loose stools, that sort of thing today, because this is often, definitely with raw feeding, we tend to be looking at stools all the time.
Yeah.
As a nutrition consultant, I get a lot of poo pictures.
I get a lot of poo pictures as well.
We are rather obsessed with looking at poo. But even if you don't raw feed yet, and you're watching this to find out more about ways to support your dog with diet and to understand digestion, vomiting, this is a really obvious symptom. It's messy, it's really there, and we don't always know what to do immediately about things like that. If our dog is suddenly sick in the house, it can be like, goodness, how can we help them?
Yeah.
So I think we'll just run through some of the sort of immediate things that you might do, and then we'll have a look at what you could maybe change, things you could implement to manage the situation or to make changes internally to your dog's whole digestive system so you can really, really help them. And ensure that doesn't happen again, and you don't have a dirty carpet, basically. So the different types of vomiting that a dog might do, let's just run through those. So there's the obvious, like food. I'll just go through the ones I want to ask you about so you know, so you're prepped.
Okay.
So we do this very often, of course. So like the white foam, the
Okay.
bile. I mentioned regurgitation, which would be food. And then the real proper sick where it's been there a while and then it's come back up. So I think these are the sorts of vomiting that you're going to see immediately. The hunger puke, that kind of thing. So
I think the main thing to remember, particularly with vomiting, is that if your dog does a one-off vomit, don't panic, because dogs have a really easy vomit reflex, and it's actually something that they use as like a self-preservation thing that they've developed, because dogs eat a lot of gross stuff, right? And so they have quite an easy vomit reflex, so that if they do eat something that is really gross and it was actually a bit too gross, they can really easily and quickly throw it back up, or if it's irritating them. So they do have quite an easy vomit reflex. So if your dog just does a one-off vomit, I always just tell people, don't panic. If they seem well in themselves, if they seem hungry, anything like that, then you're probably fine, and you can just kind of continue as normal. So maybe the next meal that they have, make it, if you're a raw feeder, don't make it a big meaty bone, make it a softer, mincier meal. And otherwise, if you're feeding a cooked food, just feed them what they would normally have, and maybe just feed a slightly smaller bit. If it seems to go down well, you can always give them a bit more later if they're still hungry. But it's not something to panic about. I think the white foam and the bile, I kind of end up grouping those together, because I think you often get a combination, kind of foamy, biley type stuff. And it can be for various things. You do get that with what we call hunger pukes.
yes.
Where some dogs just need to eat more frequently than other dogs. And sometimes I actually find that can be linked slightly with certain foods. Yes, hello, sorry, I stopped stroking you. For example, one of my dogs, she will occasionally get a hunger puke if she's eaten certain meats and lots of goatly tummy at the same time. And so we just don't feed her those meats anymore, because it obviously creates some kind of mild disruption. Poo's still perfect, it doesn't vomit every time, but you just get a bit more gurgling. So we just avoid those. And tends, for her, it's the fatty meats. It's too much lamb or duck or something like that. So she doesn't have those, just to avoid it. Some dogs you just need to feed even just a snack more frequently. So most dogs should be fine with once a day feeding, but the odd dog will just need to be fed a little bit more often.
Once, twice, or maybe even 3 times if they've
Totally, and it totally depends on the dog, their age, what other conditions they have, and lots of other things like that as to how often you should be feeding. But most healthy adult dogs should be fine on once a day. But every dog, like every person, is different. So if you get a disruption to what's perfect for them, then you might get some digestive upset.
So also to mention regurgitation, because as Vicky mentioned, the dogs have this vomit reflex. Now, if your dog is very enthusiastic for their food, or perhaps has maybe the food has a little bit more bone content than they're used to, not too much as in it's a bad batch or anything like that, but just has a little bit more bone content than they're used to, sometimes your dog can bring that up to re-eat it. And that is their aim, is to re-eat it. And of course we go, wow, oh my God, he's eating his sick, but actually he's regurgitated the food in order to create food that is then easier to digest when he takes it down for the second time. So pretty horrid for us, but can happen.
Yeah. And I think one thing that people are not very good at spotting is the difference between vomiting and regurgitation. And the main thing that you'll be observing, or a vet or health person would be observing to try and spot the difference in dogs, is that if they're vomiting, you will get a very strong abdominal reflex when they're doing the retching. So you know you get that noise that you yeah. If you have a lot of abdominal action going on with that, that's a vomit.
Right.
Whereas regurgitation, like if they've eaten their food too quickly, gobble, 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 whoop, out it comes again. There's almost no effort, or just a single splurt, and you don't get that continued retching, you don't get the abdominal effort, and that's how you can tell the difference between a vomit compared to regurgitation.
At what point would you take your dog to a vet, or would you say that people do need to be concerned about vomiting?
I think if you've got continued vomiting with loss of appetite, and particularly if you start to get blood in your vomit. Because if you've got blood in your vomit, either you've got a lot of inflammation in the stomach, or they've been vomiting so heavily that they've created inflammation between the stomach or in the esophagus or something like that, and you really do need to do something to soothe that. Because otherwise they're just going to continue vomiting and continue effectively bleeding into their digestive tract.
Before the blood situation, for instance, you probably would have seen a worsening of the frequency of vomit or something. So at that stage, you know, is it prudent to be looking at things like slippery elm or marshmallow or
I mean, if any of my dogs vomit, even if I don't think it's a big deal, I will just stick some marshmallow in their next meal.
Right. Like a powder?
Yeah, as a powder. Okay. Because I always have a pot of it at home anyway, because I think it's one of the best things any pet owner can have at home. I think of it as like a gut normaliser. It's great for vomiting, for diarrhea, for constipation.
Yes.
It's just fantastic, and it's a prebiotic, so you're going to be helping to feed all those good bacteria. So if in doubt, stick some in their next meal, and then you're going to be in a better place than you were if you did that.
And the same with hunger pukes. So if your dog is doing these hunger pukes, you could potentially be putting some of that on their food, and it might just soothe things. I mean,
or their snack could be like, I've got one client who mashes up half a banana with some marshmallow powder and gives her dog that between meals. Yeah, because that just soothes and coats the stomach, and then she doesn't get any hunger pukes.
Yes, interesting. Yeah. So why do why do hunger pukes happen? I'm getting the puke and the hunger confused there.
So it's usually related to acid within the stomach.
Yeah.
So when you eat a meal, lots of stomach acid is produced to help digest the meal. But if there's too long a gap in some patients between meals, then stomach acid can build up in the stomach and feel uncomfortable, and so they will throw some of that up. And that's often where you get the kind of biley coloured ones.
Yes.
And it's not necessarily anything awful, but that's why I always suggest, if it's happening a lot, people look at diet. Because if the diet is perfect, then you should be getting the perfect amount of stomach acid.
Yes.
Whereas if there's something not quite right, then you might be getting a little bit too much stomach acid produced. But the marshmallow is particularly good for anything with stomach acid, because it's effectively coating the lining of the stomach and the esophagus and soothing inflammation and offering a protective layer. So it forms a sort of gelatinous paste. Anyone who hasn't used it, when you mix it with liquid, it kind of becomes a bit like snot. But what that does is coats the lining of the esophagus and the stomach, and that just protects it from too much acid, if there is too much acid around.
I mean, within human naturopathy, we would say that it's not necessarily that the human has got too much acid anyway, it's that they're not producing enough, so then the acid doesn't cope with the food that they're eating, so it's not broken down enough, so it's not passing into the small intestine quick enough, So it's actually that they've got less than they
But
have
that it's
too
hanging
much.
around
Yes.
at the wrong
I mean,
times.
that's going to be the same with dogs.
Yeah.
You know, and different types of diet produce different volumes of stomach acid.
And different strengths of stomach acid,
Yes.
absolutely, yeah.
Yeah. So if we're feeding our dog a fresh food, such as Naked Dog or a different brand, or even a fresh cooked, because we've got to remember as well that if your dog or you are not ready for raw, doesn't mean you can't use fresh cooked whole foods. Fresh food is really the way to go. Those foods seem to encourage a better stomach action, a better stomach function, and a more effective amount and acidity of the stomach acid in my experience anyway, and they encourage almost like a movement, a gastric motility in the stomach that doesn't necessarily happen with these processed foods, because processed foods that you buy from a shelf, so it doesn't matter if that's a kibble based dry or whether that's one of these white tray based, they're still made with meat meal. Yes, they've got a moisture, but those seem to just sort of disintegrate more, and they don't seem to encourage this gastric motility, which then encourage it or leads to these stomach issues, in my experience anyway.
Yeah, and I mean, I think any repeated gastric issue, you always are going to end up looking at diet.
Yeah, I think it's vital. Yeah, and get them on as fresh food as possible. So vomiting, have we covered everything? I mean, I just want to say as well, the age-old chicken and rice. I mean, the amount of times people say, oh, he's sensitive, he needs chicken and rice after he's been vomiting, or the vet might say, a nice bland meal of chicken and rice. But the irony is, rice doesn't really create blandness. So yes, it's not spicy, and I think that's where we get it from, because in the human diet world, we tend to think of bland things as not spicy. So we're very correct there. Chicken and rice is not spicy. However, given that rice really pretty much turns to sugar in the gut, to want of a better sentence, and feeds the bacterias that are either opportunistic or pathogenic sitting there as part of the synergistic microbiome, you'll find that the rice would actually create an unwanted response really inside the gut system. So it's anything but bland, really.
And I mean, I think one of the big problems that I see in particularly my raw fed clients, but also in some of my really high quality cooked food feeding clients, is that when they go to the vet, because their vet is used to dealing with patients that are fed diets that are carb including, whether that be rice or wheat or whatever else, they will still say feed chicken and rice. But if you imagine a raw fed dog or a high quality cooked food fed pet, they're not used to digesting grains at all. So if they've got an upset stomach, you want to give them something bland that they're used to digesting, that's going to be bland for them. And rice just isn't going to do that, because they're not used to digesting it. The digestive system goes, oh my God, what is that? How am I going to digest that? That's not what I normally have. And actually, you want to be choosing to feed a food that's bland, that they're going to find easy to digest.
Yeah.
So my favourite things tend to be, in the raw fed dogs, tripe, just plain tripe.
Yeah.
Very easy to digest, very soft. So if you've got any inflammation in the stomach, you've got no bits of bone or anything. Or, if you've not got some tripe, to go with like a bone-free mix of something. And also then just cooked meats, basically.
Or
So cooked chicken or turkey or fish or egg. They're still the sort of bland flavours, as in all your white meat proteins. And so they're going to be easy to digest, but you're not putting in anything complicated. And if your dog's used to having carbs, I always think you're better to go with a little bit of sweet potato or white potato rather than rice. Because as well, the way I look at it is, in the stomach you've got all the villi in the lining of the stomach, and you've got all these different folds and things within that lining. I'm just having my elbow licked at the moment. And if you've got inflammation in there, then those folds are all going to get quite thickened and kind of pressed together, and you're going to have like almost deeper folds within there. And to me, if you put rice in there, that's potentially going to get stuck in those folds and add to the inflammation and keep it going for longer. Whereas if you have a more kind of like smoosh food, where it's all just like, one big soft mass, or like chunkier soft lumps, that's just going to be able to be digested without getting caught up in the folds of inflammation within the stomach.
Yeah, it's far easier as well. I mean, I think also, it's not really about the chicken being an issue. If you're watching this and your dog eats processed food currently and you're experiencing this, I would say stick with the chicken, just maybe don't worry about the rice. There's no reason why they can't have a bowl of what we think is bland, easy to digest chicken. Just miss out the rice. I mean, there's no nutritional value in the rice anyway. We're not putting anything in that's really of any use to them. So, to me, it's like stick with the chicken, ditch the rice.
Yeah, 100%, and that's exactly what I would do.
Okay, so do comment underneath if you've got any questions about your dog vomiting. Then do let us know, and we can see if there's anything we haven't covered there, because we may have missed something. So the other end.
Yep,
we
the
need
other
to
end.
have a chat about the other end. Let's just quickly pause because Sarah's come to get the dog.
Okay, so the other end, diarrhea. Also super common in dogs because, like we talked about with the vomiting, dogs are gross. Dogs eat random stuff off the floor.
Yeah,
so
that's what they've evolved to do.
The diarrhea is relatively common. If it's happening all the time, like with the vomiting, then obviously you want to be looking at other things that could be causing it. But for the most part, most small bouts of diarrhea, so 1 or 2 dodgy poos, 1 or 2 days of dodgy poo, is probably just something that your dog's picked up. Not necessarily the end of the world, just need to gently manage it like you might with the vomiting. Bit of bland food, bit of something like the marshmallow powder that we also talked about, maybe some probiotics, depending on how loose the poo is. If it's just a little bit squidgy, normally fine with marshmallow. If you've got a big old load of liquid coming out, particularly if it's hot weather, I do often suggest people get the tube of probiotic paste from the vet, because that has some binding agents in it.
Procholine or something.
Yeah, like procholine or something like that.
Okay.
And that will help to bind the poo up so they're not going to lose too much fluid.
What about live yogurt? Yay.
Yeah, so I think if your dog tolerates dairy, that's fine. And that can act as a good probiotic. And if you've just got a mild upset, then something like that is perfect. But when you've got the super liquid, I think it is worth getting the paste that's also got your clays and your binding agents and things. It's just going to help you get a quicker recovery.
So, bentonite clay. If you've got some of that in the cupboard, maybe include that in the food.
You could do, yeah.
Okay. You know what I do often with Booster, and it works, this is Guardian lead, doesn't necessarily mean it's right for your dog all the time, but I would put garlic in Booster's food. So I would be like, okay, maybe she's picked something up, maybe she's eaten something dodgy on the beach. I put garlic in because I tend to think of that as a bit of a mild but safe, good antibiotic, just a small amount. And I just seem to be very happy with that, and then she won't have diarrhea the next stool, and I tend to think it's killed off any opportunistic or pathogenic stuff in there. So I don't know it may be an irritant to some dogs if they've got real issues going on, vomiting, diarrhea, but for me, just to put that in if they eat something dodgy on the beach, it's the fail-safe for me.
And I mean, I'd say if you know they've eaten something dodgy, then the real thing to consider for absorbing toxins would be some form of activated charcoal.
Yes, of course, if they've been poisoned or in fact...
or if you just don't know, because you know sometimes your dog will have eaten something, but by the time you get there, it's already gone.
You don't know what that was, yeah.
And so if you're not sure and you're worried and you have some activated charcoal, then it's not going to do any harm if they don't need it, but that's going to potentially absorb
And if you're
toxins.
a fan of homeopathy, see, I used to use Nux vomica quite a lot for that as well.
And I mean, I think for anything dodgy they've eaten, Nux vomica is great, as is Arsenicum album, because that's obviously for poisoning and toxicity and things like that. And both of those have both vomiting and diarrhea within their pictures.
Yeah, okay. Yeah, so having these, it's almost like a stool toolkit, almost.
Yeah, and I mean, I think if you had, for digestive upsets generally, if you had some probiotics of some kind, some activated charcoal or bentonite clay or something like that, homeopathic first aid kit.
Yeah.
Because great thing about the homeopathic first aid kits, particularly if you get the pet one, is you don't need to have any homeopathic knowledge.
Yes.
You just need to be able to read.
Yes.
And it comes with a little booklet, and you look up diarrhea in the booklet, and then it will describe for you a handful of remedies within your kit and how you distinguish between them depending on the poo and what else is going on with the pet at the time.
Yeah.
And then you can read about the remedy and choose your remedy, and it gives you instructions on how to give it. So you know, something easy that you can do at home and your marshmallow.
Yeah, brilliant. Okay. So when would people really need to worry about loose stools? Because I think sometimes we can see one loose stool or two loose stools with our dog, and we can really panic and be like, oh, I must book the vet, or you know, there must be something really wrong. So when should we be worrying?
I mean, if you get very early on in a loose poo situation, so you know, you maybe have one loose poo and then the next poo there's blood, that's more worrying. Because if you've had, say, a few days of loose poos with straining and then you see a little bit of blood, that's probably just where your dog has strained so much and there's so much inflammation there that actually a little bit of blood has come out from the rectum or the anus or the end bit of the gut, and it's a tiny bit of fresh blood on the outside, and that makes a lot of people panic.
Yes.
But actually that's just from repeated straining trying to get these loose poos out. So if you can control the loose poos, normally the blood will clear itself up. Whereas if they do a slightly soft poo and then they just poo a big, you know, load of blood, that's worrying. That's more like a hemorrhagic gastroenteritis, and that can progress very quickly, and the dog can need to go on a drip and various other things. So, you know, depending on what's caused it, maybe they might need some antibiotics, or you know, that can get pretty bad.
Yes.
Yeah, that's much more veterinary. So if you're getting a lot of blood early on, go to the vet.
Yeah, absolutely.
Also, with the vomiting, if your pet's very unwell. So if they do some loose poos, and instead of just being like, oh, there's a loose poo, off we go, carry on with life, which for most of the time is how dogs deal with having diarrhea. If they're not like that, they're laying in their bed, they're lethargic, they don't want to eat or drink, or
other symptoms of present as well.
Other symptoms of illness or disease effectively, then you want to go to the vet and get them checked, because it might be that they have a temperature and they're brewing an infection, whether that be viral or bacterial. It could be that there's something deeper going on than just a bit of a tummy upset.
What do you think about fasting as a kind of support for regurgitations, sicknesses, vomiting?
I think particularly for vomiting, I think missing a meal can be really beneficial. Just rest the stomach, and you don't necessarily have to completely fast, because I know some people are really uncomfortable with fasting their dog, or their dog's really uncomfortable with it, and can be very bothersome to the whole family if they're not fed. Then you can use something like bone broth.
Yes.
And that can be like a buffer.
Of course.
So you're not totally fasting them, because you're actually giving them some nutrition.
Well, not only
and
some nutrition, fluid, but great nutrition for the digestive tract.
It's good for helping to heal the digestive tract.
Exactly.
So, absolutely. So you can feed, you can usually get lamb, beef, chicken, turkey, duck. You can make your own.
You can make your own, definitely.
Yeah, so I mean, if you don't happen to have a convenient packet of pre-made bone broth, which lots of people won't.
No, especially if it's caught you by surprise.
Then you can pop to your butcher's, get a chicken carcass or something like that. There's loads of easy recipes to follow online if you've never made bone broth before, and just make yourself a little batch of bone broth. And you can always freeze small portions of it for future times, so that you're prepared. You could just whip one out in the future. And have it all ready to go. But I think that's really nice as a little buffer, and then you can start to feed your small amounts after that.
So what if not a lot's coming out the other end? What if it's constipation?
If it's constipation, I think what I always get people to do is look back on what your dog's eaten. Why are they constipated? Is this something that's been building up? As in, have they been doing harder poos recently, or smaller poos? Is it a longer term issue that's finally come to a head? Because if that's the case, it might be that you're more likely to need to go to the vet, or keep a closer eye with the thought that you might need to go to the vet, than if it's something that's a bit sooner. If you're raw feeding, when did you last give a bone? Because if you gave a bone the day before, it could be that actually that was a little bit too much bone for your dog, and so it's going to take them a little bit of time just to get that out. Feeding a bland meal. In raw fed dogs, I always really like tripe. Really fluidy meal as well, add some extra liquid, double dose up on your marshmallow so that you're creating that nice slippery thing to help get everything to pass through.
Not
And if it's
oils. I mean, sorry.
you can put a few oils in, but too much is not good.
We must remember that oils don't act like oil in the system, so they're not oiling things. You know, they're not oiling the digestive tract, which weirdly that's where the mind goes for a lot of dog guardians. Though. Sorry.
So not piling in loads of oil, because then you've got risk of causing pancreatitis or something by feeding too much oil. But if it's just a mild case, then extra fluid. Some double dose marshmallow, really soft food like some tripe or something. I don't know why soft food like this.
Tripe is alive. It's brilliant.
If you're getting absolutely no poo, and especially if you're getting vomiting, that's slightly dangerous, should be in your mind, because you should be thinking, have we got an obstruction? Because gut obstructions in dogs can be emergency surgery. Otherwise your dog could die, because what can happen, so say they've eaten a bit of a toy, it usually ends up being a bit of a ball or some clothes or something else. Often in young puppies it's more common because they like to eat everything. Then whatever it is that they've eaten, we're going to call it the foreign body, is going to get stuck somewhere at a narrow point within the gut. And what happens then is you get sort of swelling around that area, constriction of the blood flow, and what can actually happen is if there's enough swelling, it can completely cut off the blood supply and part of the gut can start to die. And then as it dies, it releases toxins and the body can go into toxic shock, which is why it's an emergency. And what then often needs to happen is if you go in soon enough to your vets and they can identify by feeling or x-ray or whatever that there's a foreign body, go in, remove it. Sometimes you can just stitch it back up. If the gut's okay otherwise, you can just stitch back up where you've taken the foreign body and everything's fine. Sometimes you need to remove a bit of intestine if it's been in there longer, and that's why it's worth always thinking to yourself, if you're not seeing a poo, could they have eaten something funny? Could we have an obstruction? And along those lines, and just keeping it in the back of your mind so that you're not leaving it too long. Because if you do have to remove a whole piece of intestine, then obviously it's a greater risk with that kind of surgery, because if you've just made a little hole, removed something, stitched it up, that's a very small hole. If you've had to chop off intestine and rejoin them back together, that's a whole ring where you've got the potential for leakage out of there or breakdown of the wound or anything. It's bigger wounds, therefore it's much more risky. So I think obstruction when you've got constipation should always be in your mind as a possibility.
Yeah, because I mean I've had quite a few people coming here in the past, in the last year. Quite a few probably means 2 or 3, but they stick in your mind though, because the vets just gave them antibiotics, and yet the dog continued not to eat, and it was days before they realised something was actually in there, and then it becomes an emergency situation. And I appreciate it might be difficult for them to tell initially, but really I think we need to be thinking about this. The other thing I just want to bring up about this as well is that what we're talking about really today, especially just now, is that's quite acute, really. That's quite like, oh my god, my dog's got either vomiting, my dog's got loose stools, my dog's got constipation, what happened yesterday? Which absolutely we do need to be thinking about. But I think what can also happen, and I think needs to be mentioned, is that on the more sort of chronic subtle level, there can be changes happening depending on, how healthy your dog is, whether they had a vaccine even, and that created an inflammation in the body. And this sort of build up of symptoms that then leads to something that appears acute and happened yesterday, but actually is a result of a build up in the background that has suddenly then become an inflammation in the
and that could be
tract.
of lots of different types. It can be inflammatory, it can be infectious, it can also be the obstruction. So your dog eats a foreign body
and you don't
sits in the stomach for ages, and then it moves out of the stomach. In the stomach it was fine. Might have caused a little bit of discomfort because it would occasionally block off the exit to the stomach, or feel a bit odd in the stomach or something like that. But then it moves out of the stomach and into the intestines, can't go any further.
Yes.
Suddenly you've got an obstruction. So they could have eaten the toy
like a week
2 weeks ago. And so you haven't made a connection between them, and then suddenly it becomes an urgent thing because it's moved out of the stomach.
So in terms of more chronic things, I mean, one of the things that I often say to people, I know we said earlier, you know, don't panic and use oils for constipation, but the peristalsis that happens, that shunts stools along, you know, it needs certain nutrients for that to be happening. And, you know, one of the things it does need is essential fatty acids, which are very, very low in processed food. So, you know, for me, we need to be thinking about what we're doing long term and what happened yesterday. Because if we're only focusing on, you know, what happened yesterday or what happened a week before, we could be missing the fact that over time the dog has been on processed food and has ended up with this ailment.
And that's where I think you need to also look at your acute problems within your chronic picture. And so, you know, if you're getting like an acute problem here and then, you know, like 6 months later you get another acute problem, it's quite a big gap. If you find that you're getting an acute problem every month, that's probably actually an acute flare-up of a chronic underlying problem, because it's happening frequently, or even every week. Some people say, oh yeah, my dog, you know, has a vomiting episode every week, or has a loose poo every week. That's not normal. Unless every week they go to the beach and drink a load of seawater and then vomit. Obviously that's going to be something that's sort of normal.
And grass eating.
Grass eating I consider to be fairly normal. But it depends how your dog's doing it. So I almost took a picture of one of my dogs on our walk this morning because he looked really funny, like a cow eating some grass with his head down. But it was all the nice floppy loose grass, and it was just a casual like, oh, stop on the walk, munch a bit of grass, oh, off we go again. If it was, you know, you're walking along, your dog drags you to the side of the road and eats grass and refuses to move because it's so desperate to eat the grass, or, you know, the way they're eating it has that like desperate, like, I must get this grass into my mouth, it's so urgent. That's more of an actual reflecting an upset or something that's uncomfortable within the gut. And also the type of grass they're choosing. So if they're choosing, you know, lush, soft, flowing spring grass, they'll often go for that. That's quite appealing for dogs. It just helps with normal digestion. If it's kind of like stalky, tough, rough, large blades of grass, those are what your dog's using to try and either stimulate vomiting or try and shift something through the gut because there's something more pathological going on. So if it's gentle eating of floppy grass, you're fine. If it's desperate eating or harsh grass, maybe something's going on and you need to keep a close eye.
The gentle eating leads to them being sick later with the grass. It's not really anything to panic over.
Absolutely, yeah.
Okay. Yeah, I've been reading a book called Wild Health. Cindy Engel, it might be. Really interesting. It's like sort of botanical self-healing, zoopharmacognosy, but a step up. So interesting. Observations of monkeys that worm themselves using leaves. But what's interesting is they don't just pick the leaf and eat it for its compounds or its coating. What they tend to do, they do pick the rough leaves, but they will fold it. They'll sort of concertina it, like we're making a fan. They'll literally concertina it and push it down and then eat it. So they're increasing the ability for this leaf to take the worms out. I mean, I just find that amazing. There's so much instinctive knowledge within a species, which I do think are still with dogs. No matter how we've domesticated them, I do think they've got this instinctive way about them.
I think it does vary between dogs.
Yeah, it might do. How connected they are to their inner instincts. Yeah. But yeah, I just found that really interesting. I love reading about other creatures doing this because, you know, you just sort of have these aha moments.
And monkeys and worms was the original observation that led to zoopharmacognosy and that whole observation.
Okay, I didn't know that. Yeah. Okay. Yeah, it's a really fab book. It goes beyond, for me, having learnt about botanical self-healing. It goes beyond that a bit as well. So yeah, really interesting. Thank you for being with us today to chat about digestion.
No worries.
I hope we've covered everything. I think we've done both ends and what can happen, so we should have done.
But any questions anyone has, just stick them in the comments and we will see what we can do.
Okay, all right, fabulous. We shall see you on the next Naked Truth episode, and thank you so much for watching.